Welcome, everyone, to the Marketplace's presentation of the Free Market Cash Patient. I'm your host, Jeff Cantor, along with a special co-host, Dr. Robert Campbell. We're most definitely sponsored by the Marketplace for Health, Wealth, and Freedom, which is found at your-mp.com, and it's definitely is a goal to disrupt as much as we can out there in the marketplace. Well, in this marketplace, there's a lot of problems. And the one in the middle's grown, has taken on a whole bunch of other new names. And is it getting confusing? Yeah, this is just for the benefits services for low-income individuals. Try to track that and figure out how that's going to get cheaper over time. And then, of course, now everybody's starting to figure out, I got to get a return on my investment. My health insurance premium is now higher than my mortgage. And so people really started to, this seems humorous, but it's not so far from reality. And then, of course, all the information we're fed, is it good, bad, indifferent? I don't know. Who do you trust? And so everybody's following, and now it's starting to gravitate to areas that's scaring a lot of people, for sure. So we want to break that stranglehold, and that's the whole purpose of what we're doing here. Real quick to the marketplace. So when you get to the site, over the home area, you'll see webinars and continuing the conversation. This is a pretty critical one, because after we have the guest, you're going to probably want to do some follow-up with them, and this is where you're going to come afterward and connect with that person and start to engage with them in a more dramatic way. Under the webinar tab, this is where we kind of break out what we're doing. We have a couple shows that we do, and then here we are at this one here for tonight. And so with that, I'm going to actually introduce our co-host here, who's going to do a little intro for our guest. So luckily tonight we've got Dr. Robert Campbell. He's got a degree in biochemistry, but he's also a practicing anesthesiologist and also does pain management. And in 2011, he founded Physicians Against Drug Shortages, which is advocating for reform on health supply chains, of course, a needed area, but then also, very importantly, Physicians for Reform, Free to Care, Patients Rising, and Healthcare for You. So all very, very important areas of activity. And luckily, he spared a little time to spend with us today. But Dr. Campbell, could I impose upon you there to introduce our guest?
Hey, yes. Thank you, Jeff, for those opening remarks, and welcome to Freedom Hub. It's not just a catchy name that rolls off the tongue, but freedom is becoming more and more precious with the crackdown in China and the COVID virus mutating into a totalitarian regime and all the things we're seeing around us. Freedom is the most important thing that we have, and here we're at the hub of it. So tonight, we focus on healthcare freedom, and we have a gentleman named Frank Wells, who has endeavored to reduce all the middlemen, take clinics direct to where patients are working, reducing the middlemen, improving the access, and of course, most importantly, reducing the cost. The government and the corporate cronyist capitalists would tell us that we need all those middlemen. Well, Frank is telling us, wait just a minute, there may be a better way. So with no further introduction, Mr. Frank Wells, please tell us how we can discover a pathway to healthcare freedom that we can all afford.
Love to, Dr. Campbell. Thank you so much. Can you hear me okay?
Excellent.
Fantastic. So we know that large employers have the opportunity to have on-site medical clinics, right? We see it all the time here in Charleston. Boeing and other large companies have their on-site medical clinics for their employees to keep them healthy, keep them productive, staying at work. And that's a great resource for very large companies. The smaller companies, which has been defined as 500 or less employees, typically don't have the resources to add an on-site medical clinic. So part of our concept is to address that need and to bring that affordably to the smaller companies. So we don't put a clinic on site for those employers, but near site. And we eliminate some of the challenges of an on-site medical clinic by doing it near site. We eliminate the liability of having a clinic on their workplace. We eliminate the cost of that. We eliminate any issues that might come up with HIPAA, with some folks that work at the company and having access to some employee information, and the ongoing cost as well of operating it. We have a local large shipyard that has anywhere between 500 and 1,000 employees, and they send all of their injuries to us, but they do have an on-site medical clinic. It was their heart to offer that to their employees just over 15 years ago. They did share their cost data with us with full disclosure that we would use that data and analyze it to figure out our value proposition to other small employers. And what we found that having that clinic on site for them costs them 2.5 to 3 times more than if they used a near site medical clinic like us. They are willing to do that. They do that with full eyes open because it was just their heart to do it and care for those employees. But so many other employers can't afford to pay 2.5, 3 times the cost of providing medical care. And so one of the other benefits of having a near site medical clinic for employer groups is the shared overhead. So multiple employers having access to these clinics that we have here in town and being able to afford the care for their employees, as well as making that care available to the dependents, the family members of those employees as well. So we do fit under the DPC model, direct primary care model, but we do it a little differently because we came from a system that had urgent and primary care under the same clinics. We know that most of those are separate clinics. There's direct primary care or primary care physicians, and then there's urgent care, doc in a boxes, like most of the country has called them for the last decade or more. And we put them together because having direct primary care Monday through Friday, 9 to 5, is not the best convenience you can offer, one, to the employees, and 2, to the family members. So in our model, we like to have an 8 in the morning till 8 in the evening hours every weekday, so Monday through Friday. We also have weekend hours on Saturday from 8 to 5. And so those services allow folks to use us after the workday. They don't have to take off from work if it's something that they could get done, a mole removal or something, or a weight loss visit, or have your annual visit and not miss hours during the workday, which for most employees costs them money. When they miss working hours, that's not much fun. They typically need to make those up because they budgeted themselves pretty tightly to their monthly income and their monthly expenses. So we like to have all the services, the urgent care and the primary care, in the same place with extended evening and weekend hours, which we would refer to as urgent care hours, and offer all bundled, a huge array of bundled services within that model, so that the employee pays nothing for their visits, which is typical of a direct primary care DPC model. And so they can get x-rays and EKGs, they can do labs. If they're diabetic, get their A1C and their blood sugar done, CBC and mono and strep and flu tests and H. pylori and other types of tests. We do injections with antibiotics and anti-inflammatory steroids to get on board while they're in the clinic, trigger point injections. We do laceration repairs and INDs, and all of that is done in clinic. And the employees simply come into the clinic. If they're on our membership model, paying a very low monthly rate, they get to go to the clinic for free and get all those in-clinic services done for no added cost for them. If they do end up having a lab done, say they were exposed or thought they were exposed to black mold in their home or apartment, we can order that test. And most of our send out labs are $10 to $20 each, because we go to the lab company and say, you're not billing any of our patients, you're billing us directly. So we get a volume discount as with multiple clinics, and we simply pass that on to the individual when they choose to do some sort of lab that goes out of our clinic and to the lab to get done. So we love making that affordable for the workplace. In our model, you can be an individual and be a member for $75 a month. You can come in one day or you can come in 30 days a month. You can use our video visits as well, telemedicine with video. You can also use our drive-through services, some of which are all included. The flu and strep tests are included in a drive-through, because if you have the flu, you really don't want to get out of your car and go into a clinic. And plus, it's safer for the other patients in the clinic to be able to offer that through a drive-through. So you can imagine a year and a half ago, we added drive-through testing to our clinics because of COVID. And it was a wonderful blessing to be able to offer that to the community. No one got out of their car. Tens of thousands of drive-through COVID tests were done last year, and none of our staff were infected with COVID all of last year. And we believe it's because the patient was in their bubble, they were in their vehicle. Our staff were in PPE and able to collect the specimen and send them off to the lab and get them timely results so that they could travel or be with loved ones, be with family members that might be immunocompromised or older, and they would know whether they were positive for COVID or negative for COVID. And by the way, we also do the antibody testing to show that people do have antibodies either from their illness or if they've chosen to use a vaccine to get their antibodies, we can do that as well. So all those services are offered within our model. For the groups that enroll at least 5 employees or more, we knock down the $75 per month rate to $47 a month, which we have found to be incredibly affordable, particularly when you include all of those services, the EKGs, x-rays, the labs, the shots, the injections, and so forth, the evaluation by the doctor. And their dependents can even join in that medical membership for just $37 a month, with the intent of keeping the whole family healthy. We know, those of us who've had a family and had kids, that if Johnny has strep, it's very likely that one or all of us in the family might get the same thing. So we love keeping that whole family unit healthy. Because we're not an insurance plan and we're not held to some standards that might be for the insurance plans, a dependent for us can be someone that just lives under the same roof with the employee. So it could be a roommate, it could be a cousin, it could be a family member that's come for the summer and just wants to have some sort of preventive care coverage while they're here. We have that added flexibility because we don't have someone telling us what to do and what not to do for a patient. So we really just want to keep them healthy and productive. We know that income and work is a blessing. That's how we take care of our families. We believe that all work, all jobs, all workers are essential, particularly when they're taking care of themselves and their family members and loved ones. And so we just try to offer that full suite of preventive care services for the small employers. We have some larger employers as well, certainly over 100 employees and larger, but we really want to take care of those smaller groups. We're always careful to let our affiliate partners, what we call them, the companies that choose us for their employees, to know that we do not cover the catastrophic care that they might need from a surgical center or from going to the hospital, some sort of injury or catastrophic need that they have. And so we're delighted to fit right underneath a high deductible health plan that we know over the last 10 years, many of those plans don't pay the doctor or the clinic for the visit after the copay. If the patient hasn't or the insured hasn't met their deductible, that insured is going to be basically self-pay until they met their deductible. So we fit very well underneath a high deductible health plan or medical sharing plans or any other way that someone can get that catastrophic need covered as well. We simply sit in the preventive care space of pretty much complete and all urgent and primary care needs. And we love to tell people about Good RX and to use, actually go on the web and not just tell the pharmacy you want a Good RX discount, but to go in and get that 6-character code to give to the pharmacy to get the best discount you can on medicines. And then we also refer to specialists who offer discounted direct pay pricing, such that our folks, our members that come in and have no insurance or maybe just that catastrophic coverage that they have, that they can still find affordable care even in the specialty care space. So we love sort of putting that all together. We don't have an official care advocacy group. We just do that as part of our normal day-to-day business. The clinics that I was the CEO of some other clinics that we sold almost 3 years ago. I was there for 12 years as the CEO and CFO and every other hat until we hired a full-time CFO and HR and everything as we grew, and was able to get great experience. We filed to 640 different insurance companies, and we found out that cost of filing claims and collecting claims was just over half of our cost of providing medical care. So in building this model at Holy City Med, we knew that we wanted to do it very affordably and still have the speed and efficiency that we had in the other model, and still have the quality of ER trained doctors and PAs with the specialty in urgent and primary care. So nothing scares them. They've been in the ER for years, and they know when to treat the patient in clinic or to refer the patient to either a specialist or to the hospital if that need, if a patient does present with a need that would be more appropriately taken care of in the hospital. So that's kind of how we've set up our clinics. We also allow walk-in visits because we know that shares some of the overhead as well. So someone can walk into our clinic and get all the services that are bundled for our members and not know us from anywhere or anyone, maybe be traveling through Charleston, and they can walk in and pay $97 and get all of those bundled services in a walk-in visit, get all the treatments, and walk out the door and never see another bill or anything from us, because it's expensive for us to go and send bills and collect and have people in a room typing on computers, trying to figure out how much is owed and what's due, and then trying to collect that. We've just eliminated all of those added expenses to be able to truly offer affordable care, mostly through the memberships, but again, through walk-in. And then the last thing we do is occupational medicine. So injuries in the workplace, we care for those just like our walk-in visits. The company pays for them, so they get access to the treatment plans that go on with their employees. It's separate from the personal healthcare membership plan, where that information stays just with the patient themselves. And so we kind of are a mix of multiple models of both near-site medical clinic, urgent and primary care, occupational medicine, and mix it all together and offer it all in the same clinics. We have, lastly, and then I'll stop, we can take some questions, but we have 5 staff members for every doctor or PA here, such that the doctor or PA never has to type in a chart. There's a scribe that works with them. There's an x-ray tech, there's a medic, there's a vitals tech, and then there's someone who's doing check-in and handling that part of the process as well, the payment process. And so all those folks are running around doing things for the doctor, only asking the patient one time, what are you here for? And doing the history and background, the family history and their chief complaint, and then transferring that knowledge to the doctor before they walk in the room, so they can walk in the room and say, well, it looks like you've had this, this, and this, and and oh, by the way, your shoulder's been hurting for the last 2 years. We can get an x-ray for you as well and treat your nausea, vomiting, diarrhea, and all the other symptoms that you may have, upper respiratory, UTIs, and so forth, while you're right there in the clinic. So it's incredibly efficient. The tests are done, and the doctor comes back in with all the answers to the test, the CVC or mono or strep or flu, or the x-ray that they've seen on the screen, and then they can treat the patient appropriately, give them the proper treatment plan, and get them on their way and back to being healthy. So I promised I would stop. I didn't lose my breath.
No, that was pretty good. You didn't come for air too much. I got to tell you, from the rest of us listening to what you're talking about, I have to say what you're doing is like pathetic. Why? Because none of us get to tap into it. It's such an obvious example of what we try to talk about here, is that the market has figured out like exactly the right mix of services and the right number of people it takes without being top heavy. And therefore, look at the price difference like you described is absolutely absurd. So look at all that markup that's in the industry that's really just depriving everyone of care. In your model, there's a couple of questions. What typically is your proximity to the employer do you try to maintain?
Say that again, what to the employer?
How close do you like to typically be to the employer's physical place?
Sure. So within 5 miles is our model. So we'll our clinics are within 9 miles of each other. So really, if you draw the 5 mile radius, they overlap. So that's typically how we go after a market. The clinics are about 9 miles apart. Now that's not going to be the case throughout all of South Carolina as we continue to grow, but in the larger markets, that'll certainly be the case. We do have some employers asking us for a specific location. When they have a certain number of employees, we can locate in an area that aptly serves their employee group, but also with the idea of explaining to them that we want to be accessible to the family members as well and other employer groups. So again, we're not building the on-site. We're always going to build, it's hard to say always, but we believe we'll always build a near-site medical clinic for the elimination of liability and cost to the employer and the convenience and access for both the employees and the family members and the community as well.
Yeah, it makes perfect sense. With the numbers of businesses, what would you be a typical number, optimal number of businesses at any one of your clinic services? Forgetting the walk-ins and anything that's stray business.
Yeah, so our clinics will hold up to 8,000 member lives. So that just depends on the size of the businesses there. But because we've run clinics in the past, we know what the model looks like. Our footprint has an exterior hallway that's just for patients, because when you are seeing a lot of patients and they're not waiting, no one's in the front of the house. We have a lobby where the family of patients might wait. But during COVID, of course, no one's been in there. We just they either check in online or they check in very quickly at a traditional front desk check-in, and they're immediately back to a room. That's to keep people safe and healthy and not to just to quell their fears, if you will. And so, but we have this outside hallway where the patients go, so no one's ever running into a patient with crutches under their arm or carrying needles or scalpels. That all happens in the center of the building where the clinic is, where all of our labs are run. The only time patients come into that center space is when they're walking about 9 steps to the digital x-ray room, have the x-ray done, we walk them back to their room through the clinic area, and then that's the only time they're ever in the clinic area. So it really allows the staff to own that clinic area. Every other doctor's office just about you go into, the patient on the floor, and the patients are walking through the area where the nurses are really doing their work, and we found that to be disruptive to that workflow, as well as dangerous to the safety of the patients and our staff. So we kind of have an outside hallway where the patients it's theirs. So it's a nice calming. It's a little bit of a walk to get around the whole building, but we love doing it that way. It makes it incredibly efficient. Again, the doctor has 5 staff members helping them. Our doctors never become data entry clerks. That's what the scribe is there for. Of course, they review all the charts before they're digitally signed, but they are not typing on the keyboard themselves to put information in the computer. They use a sheet that allows them to use a lot of abbreviations and circle lots of things without writing anything, and then making their notes, their physician notes on there. And it speeds up the process, gets all put into the EMR. So it's recorded for subsequent visits, obviously, and for that visit as well. And it's just incredibly efficient. The doctors and PAs that work with us love it. They don't spend 75% of their time in front of a computer with no patient nearby. They spend all of their time evaluating, diagnosing, and treating patients instead of doing other things that they weren't trained to do.
Very good. Dr. Campbell, did you have a question for Frank?
Well, Frank, wonderful presentation. You're proving a lot of things. You can be very physician-friendly and physician-centered, which also makes you more efficient and makes the physician less burnout. You're also patient-centered because you're all about meeting the patient's needs in the most efficient manner possible. And of course, you have the employer engagement, small business. And the thing that I would say and ask you is, I have found it kind of hard to get small business owners to step up and say, if you join with these innovators, you can have better healthcare for less money. The second side of that coin is it's not cheap or lesser healthcare. Just because we can deliver healthcare at a lower cost point is because we're repurposing so many dollars from the inefficient bureaucracy and the middlemen and the claims process. We're repurposing that. So many employers come to me and say, if it's this cheap, you must be cutting corners. So how do you engage employers, and how do you demonstrate that you're not just cheaper, you're actually better?
Yeah, no, it's a good question. So the initial consistent feedback we had from employers was, sounds too good to be true.
Right.
And so as we've been open for almost 2 years now, they can go and look at our Google reviews, talk to other employers in the market and the community, and now know that all of our doctors and PAs have spent time in the ER. They're specialists in urgent and primary care, and so the quality is there. They will often come and take a tour, or they'll have employees come in. I don't want to say this arrogantly, but we've had many people say it's the best medical visit they've ever had in their life. And it's incredibly humbling. I mean, that's amazing. These are, not 20-year-olds, because 20-year-olds don't go to the doctor. Not all, some of them don't, but 40, 50, 60-year-olds that have been in the healthcare space and been to doctors before. And so to have them say that about our facility is just incredibly rewarding. Obviously, you use social media to share those comments that they allow us to share in the public. And then the affordability really kind of grabs them, as you sort of mentioned, is it cheap? And so what we tell them is, look, we've run high volume before. It's a blessing that we ran the other clinics here in Charleston as well. We're known in the marketplace. Many of, some of us said, hey, we'd rather go to this newer model and get rid of insurance, and can we come join you? And so some of those folks worked in the model as well. And so we're known in the space, we're known in the community. When we move to other cities or expand to other cities, that may be more of a challenge, and we'll have to figure that out. But by the time we've got 7, 8, 9, 10 clinics in this location where we're known, it'll be easier to point to, look at that market, look what we've done there, X amount of employer groups with their employees. And so I think it'll be even easier when we grow outside of our first city here in Charleston as well. But it is an education piece for them. They've got to come and see it sometimes, and they'll send us their injuries at first and go, wow, that was incredible. For $97, they walked in, they had a laceration repair, they had an x-ray done, something fell on their foot, and it was fast and efficient. They went right back to work and said, don't use, bruised foot. and give them a light duty note and send them back to work, and let the employer, let them count paper clips or whatever for the rest of the day. So they don't necessarily have to be sent home. They can be productive in the workplace. And then they realize that we're really trying to care for their employees without just charging for these added services. And lastly, I'll say that our doctors are not incentivized to do added tests to check boxes for a higher reimbursement, or a higher code, a higher level for that office visit. There's no incentive to do that. We can use all of our testing and lab, internal and x-rays and EKGs for diagnostic capabilities, with no incentive to do things just to, check boxes and get higher reimbursements. So it's really a delightful environment. And then to have the specialists that really help us out, that, we've had a group did a thyroid ultrasound, direct pay for $100. The insurance price was $472. We all have examples of paying for an insurance plan and then paying more for a service rather than just being self-pay and a direct pay price. So we try to offer those as well. And once they understand that and they see some other folks in the marketplace that have enrolled their employees as members, it really started to roll and gain some momentum. But yeah, it took a little while, and then we were going through COVID, right? So we were running a drive-through outside, and we actually built these wonderful clinics for our employees and our patients to enjoy. And most people were in the drive-through for a while. So,
Well, we want you to build some clinics here in Pennsylvania this fall, if you would.
we're working on South Carolina first, but we appreciate the interest outside of the state as well. But we will finish Charleston and then grow within the state of South Carolina, and then decide what's next strategically. But yeah, we really just want to help smaller employer groups. And again, the SBA qualifies under 500 employees as a small business. We think some of those are pretty good size, medium, bigger businesses, but that's the way they're identified and defined that way. So we'll help every business out there. And we are talking with some larger employer groups as well that, again, I think I mentioned earlier that they've said, hey, can you put a clinic right here? You'll serve our 1,600 employees and their family members. And by the way, there's a couple other manufacturing facilities around here and some rooftops that we can help out as well. So it'll change as the market demands, and we're glad to be flexible with the demand as well.
So if people have questions, they can raise their hands, or Charles or Jeff, do you have a follow-up question?
Nope, I will, but Charles is here. Let's see what he has to say.
Thanks, Jeff and Dr. Campbell and Frank. Great presentation. Tell me a bit more about your influence on the specialists to whom your doctors and others in your clinic refer. We've had lots of presentations from specialists trying to go cash. They love the potential of it. A lot more time with the patient, less hassle, obviously chasing billing or dealing with coding. I assume you've got in your head, or unofficially, a network of specialists that are good and are dealing with cash prices. Tell us more about that, because if you get every part of the referral process with good cash pricing, that's going to really improve the system, isn't it?
Yeah, we think so. We choose the specialists first, and then we, the best ones in town, like a Charleston ENT here in Charleston, and then we ask them, do they have self-pay pricing? What are their hours? Tell me about your locations. Our doctors need to be able to call and do a quick 1 to 2 minute consult, especially for orthopedics. Hey, look at this quick X-ray. I just sent it over to you. And so we have lots of requirements that they'll accept all of our patients. We don't pick and choose. We send them all to that one specialty and specialist, unless they're sort of in a particular region or area of the city. And then there's another one over here that might be a second imaging center that are owned by 2 different practices. So we might have more than one in a certain specialty area. But we choose them by their reputation and by their skills and by their experience. and then ask them for those self-pay pricing. I can't think of one right now that doesn't also accept and file insurance. Gosh, there may be a couple. Oh, there may be a couple of imaging centers. There's an MRI place, $300 MRI, and same machine and doctor and equipment used, and the read is included and everything. So they're not filing insurance. That is direct pay. So I think more and more we'll see more that are just direct pay. Right now it's a hybrid, but they are offering very good direct pay discounts because, as you said, Charles, are not having to file those claims and come back and collect, from the insured later on. The other thing I've forgotten to mention early on is, I think many of us can remember 10 years ago when we went to the doctor, we paid our copay, and we never saw another bill from the clinic. That was a time when the insurance company was paying for the rest of that visit, at least somewhere around 90-95% after the copay. And so as a clinic operator, we wrote off lots of times the leftover 5% owed by the patient, because it would cost us more than $10 or $15 to go and collect those monies and have people sending out statements and stamps and everything back then 10 years ago. And over the last 10 years, that model has been changed in that the insurance company no longer pays the rest of that visit outside of the copay, or most of that visit outside of the copay. Now they say that the insured has to have met their deductible before the insurance company starts to kick in financially. So the effect of that has been employees have stopped going to the doctor. They found it to be incredibly expensive to have a cough or congestion or just a UTI or something. And so they want to avoid that $250 doctor visit just to find something out. So they'll go to the pharmacy and get something over the counter. And if it's a UTI, you can fix it with a $7 antibiotic. But then if you don't fix it, they might be in the ER a week or two later with a kidney infection, and that's not good. So we're trying to eliminate that, and just, again, that affordability and the employers enrolling their employees so there's no hurdle. It's first dollar benefit, I think, is the term the insurance folks use, is that the employee pays nothing to go get care, and the employer bears that burden. The other thing I'll mention is the employer doesn't have to pay the whole $47 a month. They can pay a portion of it and have the employee pay some bit of it, just so the employee sees it on their paycheck every 2 weeks or every month, how often they get paid, and realize, oh, I have this service, I should probably go use it. I'm diabetic and I'm supposed to get that A1C done every 90 days. And oh, by the way, it's zero cost. It's included in my visit. Not to mention, refills with video visits and such. I meandered a little bit. Did I answer your question?
You did, and more. That was fantastic.
Okay.
That's what we deal with every week for 3 years now is, how do we get these better pricing and better experience? So what you're talking about with, no out of pocket, no barriers to quick care, and seamless referrals to specialists, that's a good quality, efficient, affordable system.
Well, and Charles, we spoke earlier about this too. We want to do more. So realize that that's pretty good package, bundled level of services. But we want to do more. Once we hit certain milestones of members in the marketplace, we'd like to offer the care advocacy role, where you can find good prices and great surgeons for different types of surgeries or procedures that are done, colonoscopies and other imaging and that sort of thing. We'd love to also add nutrition advice. At some point we would direct people to mental health resources. We're actually bringing in some mental health resources through a nurse practitioner that specializes in that area as well. And maybe there's vitamins and minerals and keeping people healthy and sending them exercise programs. So as we grow our membership base, we do intend to add more services. You could even offer chiropractic services and massage and other things that just are good living, healthy living type ideas. We know in the medical business that if we help somebody lose 30 pounds, they might be able to take less and less of that medication that they were taking before, because their body is now responding better to the needs and keeping them healthy. And so really we want to treat the whole person. We've started very much with a medical model, but we'd love to add some of those integrative pieces, wellness pieces, preventive care pieces, and really just keep people healthy and productive in the workplace. We think the employers will appreciate that because people won't be out as much, and they can use all their vacation time to be with their families and do things that recreate and get them away from the workplace, where their brains can be more creative and that sort of thing if they don't work in a creative role already. And that's just all part of a complete wellness plan for people.
We'll kind of know when you've reached the limit of everything you need to add when the last thing you had is a bar. It's like, hey, I'm getting all this work done, and then at the end, I'm gonna take a steam and we're gonna get a drink and hang out. So it's great. It's really exciting. Good for sure.
We can offer IVs as well, so we do have IV fluids as well.
Oh, okay, there you go. I was gonna say, what's kind of like your time frame to build out the state?
Yeah, we planned on 5 years within the state of South Carolina before we take a step back, and any debt that we've accumulated, the thought is that we would eliminate that, and then take a real strategic look at the states around us. And so we're in South Carolina, in Charleston, South Carolina. So that would be mostly the Southeast.
Sure.
And then as we go, once you're able to build 20, 40, 50, 80 clinics in a year, you sort of build a system and a model in order to place that. Some people say, well, will you franchise it? I don't know. We, are you building it to sell? No. Our intention is to keep it, continue to care for folks. We're a low margin shop, so it's very affordable for folks. So as we build that extra volume, that just allows us to build more clinics. And so it really is a volume model, but not to the extent where there's waiting times. In the last model that we sold 3 years ago, we were seeing 150,000 patient visits a year. We had 0 appointments set. No one ever made an appointment, and the average wait time was 7 minutes.
Remarkable.
And I will tell you, it's simply because we didn't have the doctors doing things that are not doctoring. We just allow them to be a doctor, and they love it.
The one thing everybody's kind of zoomed by like it's a normal thing is the fact that you keep saying this, but that's been the biggest issue for most people. I just happened to have a conversation with someone today. They said, they said, here's my appointments at 3. By 3:30, they finally took me in what he called the napping room. And then I had to hang around in there for a while till the doctor showed up. So what was the doctor doing all this time, and how can they not have their scheduling system organized enough that they're making everyone wait? But that's a fantastic feature of any of these direct primary care positions, is the speed at which you're in and out. Because if I'm sick, I don't want to wait. I need to see you now, doctor, kind of a thing.
Right.
So that's fantastic. I was going to see if we got another question. Bob, did you want to put in a little comment there?
Well, one of the big pushbacks that I get from health policy experts in Washington is if you build the cash pay space, if you make it bigger, more and more people, you won't be able to have enough primary care docs to take care of those patients, and you definitely won't have enough specialists. So I know about the specialists. How are you doing with recruiting doctors to meet your growth needs?
So to date, we have had 0 problems with that. We like to take, again, the model before was started by an ER doc. I went to work for him as his CEO and grew that model. He had a clinic when we started. And so I was his CEO for 12 years. And so we really have adopted that model of ER trained folks. So when an ER doctor gets married, spends a few more years in the ER and starts to have kids, and then soccer practice and ballet and other things, it hasn't been a problem for us to recruit them to say, did you really go to medical school to be a doctor? Would you like to spend all of your available time evaluating, diagnosing, and treating patients, as opposed to time recording visits, which is what we know in the ER is 75% of their time or more is where they're spending their time, and only 25% of their time or less is actually with a patient. So they really love it. All that to say, we haven't had a recruiting issue at all. Again, I'm from Charleston. We had the prior model here. I have a reputation in town. My mom still lives in the same house where I grew up. So I'll be able to answer that question better when we go to the next city, where no one knows us personally and that sort of thing. They might know our Holy City Med reputation by that point of being open for a few years. I'll be able to answer that question better. Right now in the market where I know very well, hasn't been an issue at all. The physicians love it. They're ready to get rid of the 24-hour shifts or the overnights or the, all that kind of stuff, and be able to work in a model where we're open, Monday through Friday, 8 to 8, and Saturday hours. And, we're closed on Sunday. We know that we'll have to address that need at some point, probably with a 24-hour nurse line, which is another add-on that we'll look to add very soon. And so that'll give folks the care that they need when we're not open. And so we do have some employers say, well, what happens if at 2 a.m. you have a problem? And I say, well, what happens now at 2 a.m. in the morning when you have a problem? Okay, we'll do that. Do that same thing. So,
well, I don't think you'll have trouble. You're offering a physician what they're starving for in their careers right now, and there's so many dissatisfied physicians. Charles, for the specialty side, I will tell you, in my community, for instance, is typical. We have about 40% of our specialists are still private physicians, and we all have about 3, 4, or 5% of the seats in our waiting room are cash pay patients. If we could have 50%, we'd take it. And so there is that capacity in that for the specialty side. And as long as you give physicians and patients what they want, you're going to have primary care docs and you're going to have patients coming to your clinics, because everyone is looking for what you have, and it's so rare. So congratulations for great idea, great execution.
Very true.
Thank you.
Here.
Thank you.
Doc, Bob Stabel, I know you had something you wanted to throw in there.
I'm just listening so far. It's fascinating.
It is, isn't it fantastic? I mean, it's such a great little mix of, like I said, all the key things. You're like the perfect mall. I didn't want to go to the one store. I wanted to go to the strip center because, like, everything else that I want is at that same place. I need to go to the grocery store and the clothing store and the shoe store. And you're like everything that I'm going to need, short of like I broke my leg and I have to go to the hospital. It really is fantastic.
Frank, I'd like to meet you offline. I have some ideas for once you break out of South Carolina. I have some big ideas for you that I've been nurturing, and I think you'd be the perfect audience to vet them. So look forward to meeting you.
But not until we get you to Pennsylvania first.
What about me here in Cleveland? Lo and behold, Charles has got little kids. He probably needs one pretty badly by him.
I will do
Frank. It's 5 years. 5 years.
Ohio next.
Well, and I'll tell you one of the challenges, and maybe you all can help us solve it. So we love standalone clinics, but we know that increases our costs of real estate. So we have, there's some consideration, and Bob, that some of you all know, is putting together sort of a group, a suite of different businesses. I mean, you could have dentists nearby, you can have physical therapy, you could have a neurologist and an orthoped and some imaging, all in a sort of an area where you are a medical services destination. And if that, drops our cost of real estate, because that really is our largest financial barrier at this point, is, building more clinics. And of course, once you get it built, and payrolls, the investing in your employees is the next one. But that's the biggest cost of, standalone centers. So we, you might help us sort of figure out, what's the right partnership? What's the right one to be with? Our corporate color is purple, Holy City. So we use a royal color. Jesus picked it first, but we're using it. And so we'd have to mix in with that color somewhere in there. But we do think there's a way to be co-located with other type of groups and where it makes sense. So, you guys, I just know how to operate an urgent primary care center.
A big part of my past career was building medical office buildings that had wellness centers in them with leading hospitals like Johns Hopkins. So I have a lot of medical real estate background. So I'd love to share some of that with you. So.
Very cool.
And that,
Very
that
cool.
really becomes the ultimate synergy for sure. You're right about that, because I need the dentist and a couple things that you're not going to ultimately put in there. So that makes for a great destination.
One question, Jeff.
Sure, please.
Holy City. We like to go on tangents here at times. Charleston, why the Holy City?
So Charleston's nickname is the Holy City. When folks used to reach Charleston by water, the only thing they would see is the steeples up in the sky. When you're in pluff mud, you can't put the foundation down deep enough to get a really tall building like you can in New York City that's built on rock. And so with the buildings being shorter and the steeples sticking up higher than the other buildings, it became known 150 years ago or so as the Holy City. So we use that moniker for our model. We also own urgent and primarycare.com. Who knows what the name might be in another city or another state. But most people within South Carolina and even some nearby states know that Charleston is nicknamed the Holy City. So we think that name might last us for a little while, but if it doesn't, we're flexible and changing that or doing that differently in some other cities or states.
No, it makes sense. You can more localize it by doing that in some instances.
Yeah.
One thing that's critical is that you don't ever sell the operation, because whatever you're doing here will be toast.
You're right. Well, and we do know that the name, we won't choose the name Quick Quack, although it's kind of fun as a doctor in a box. But anyway, and to keep it, in the family and keep it growing, that really is our intention. And if you build it right, and you need to have margins so you can care for people in the community, take care of your employees. I mean, we have retirement plans for employees matching, and we feed them every day with lunch. And, we put $10 Walmart cards in our break room because they might need to take care of somebody, even a patient that comes in or somebody doesn't have food in their pantry. And so we just try to do a bunch of stuff for our employees that makes it a good environment for them. They want to come to work. And then when we serve them, much like Sir Branson would say that then they want to serve and take care of others. And that's really our intent, is to serve them so they can serve the patients.
Well, it's critical. That's a big shortcoming of a lot of business. They think they're serving the customer, but you're also serving your employee. And if you forget about that, you have all that turnover and every other thing. Forget even the fact that doctors like to be a doctor for a change. You timed out on us there. Well, your timing is pretty good on the light.
No.
The light extinguisher. Well, we're kind of actually.
Lights.
No, we're kind of at the end of,
PM.
we're kind of closing at our time slot ourselves here. So your timing on the lights going out wasn't kind of apropos. But I did want to tell you, this really is a very exciting thing. And it also is very indicative of why this continuing the conversation that we do is such a critical part of this. So I definitely want to thank you for today. I know Dr. Campbell wanted to give you a little accolades as well.
Yes, Frank, thank you. And thank you for your vision and your efforts in the right direction, as opposed to just getting stuck in the legacy system, which is failing. So what you're doing will pay dividends now and into the future even more. Thank you.
Well, thank you. We've had plenty of people pour into us. We do have an advisory board and a prayer board. And so we look for divine guidance. We look for guidance here from others with more wisdom and discernment than us. So, and so many people poured into us. It's been really cool. So thank you.